today's day and age, starting from a 4-year-old to a 90-year-old, we've all become very technologically oriented. And where our forefathers did a lot of walking outside, we are all kind of confined to a chair.
Absolutely.
But with that comes its own problems.
Absolutely.
So I think every household, you will have at least 2-3 people saying, oh, my neck hurts here, my back hurts here, I can't sit for a long time. We've become quite rigid. But all of these pains can't alarm us, correct? But it still troubles us. So what is it that we need to understand about back pain, about neck pain, from here down, that allows us to work comfortably?
After headaches, neck pain, back pain is the commonest thing which actually makes a patient go to a doctor. A person who is erect in his lifetime will have 2 episodes of pain in his lifetime which requires or warrants a hospital visit. Now, if this is the commonest, then how are we actually looking at it? After Corona, unfortunately, people started working at home. Their own relatives, everybody, whoever of the family, extended family, are all sitting in couches, beds. Ergonomics are completely lost here. Once this is lost, your spine takes the brunt. Unfortunately, muscles and spine, once they're getting affected, you will end up in some form of disc concerns, joint concerns, ligament, tendon concerns of the neck and back. Muscle is the commonest. Now, if this happens, you will end up in pain. Now, if you feel saying that this is something which is going to be troubling, then you will have to get back to your ergonomics, get back to how you actually have to work properly. Otherwise, this is not going to stop. What should we actually look forward to as a sinister thing over here? Any form of pain which is coming from the upper neck going up till the toes or lower back going to the toes in the feet, and it is causing weakness in the limbs. That needs immediate attention. It has to be seen by a neurosurgical team at the earliest, because it could be a bad slip disc which could be pressing on the nerve at a very, very bad posture, or because of lifting some weights or doing deadlifts, doing any other kind of activity could also lead to back pain. Whereas looking into the bones and things can cause neck pain. Now, to summarize this, after COVID, you've gone into a bad posture, leading to strain on the muscles as well as onto the small joints in the back, leading to this kind of concerns, spasms, leading to disc concerns and pain. That is what is the nutshell in whatever you asked.
What I asked. And IT professionals and those of us who work from home a lot, we are the ones who are actually going to get troubled a lot. Am I right, sir?
Might not be true also.
Okay.
Might be anybody. As you rightly put across, now a 6-year-old would be actually looking at his phone much higher compared to a 16-year-old also. There's a very high possibility, because the parenting want their child to be quiet. The first thing they give the child is the
tablet or the phone or anything.
Therefore, that also could actually be there. So I have seen children, I'm sure you would have also seen in the clinic, children who are going to school are getting too stressed because of overexposure to screens. And this neck pain and back pain has actually become a part and parcel is what we can actually look at. And the teachers or the people at home, even though they've understood about it, there's a lot of awareness going on, are unable to actually desensitize them back from where they are. And you put across a very good point that people are not going out, they're not socializing out, they're not talking, they're all busy in their own world. That itself is social isolation. So therefore, chronic pains will become worse because of screen exposure. Your physical capacity is down. You're looking into it, straining yourself. Next, your sleep is affected by the blue light, which is getting exposed. Then your social isolation. All of this will worsen.
So when we get patients to the chronic pain clinic, from where I stand, it becomes very important to understand, like you said, the sleep pattern, the mood, and what they are actually doing on a day-to-day basis. Plus our ability to slouch on a couch. So if a person has pain, when do they have to consider it the right time to approach, especially low back pain? We talked about headache. We touched a little bit about the neck pain. When do you say is the right time to approach a pain specialist, especially for low back pain and sometimes they're not able to walk, do the housework? What's the right time, sir?
The patient has actually undergone treatment
Yes.
from his general practitioner or from a specialist neurosurgical team or neurosciences, as well as they've done all the rehabilitation processes and they're not becoming better. Or they've been there, no surgery has been advised and the patient's pain is lingering. This is where they would actually need to visit the pain clinic. As you put across rightly, these pains could be there after 6 months or 6 years or post-surgery also. All these group of patients would benefit from visiting us. Now, from where you started off is this just not affecting physically, psychologically and other aspects also need to be looked at. Now, sleep. Now, sleep gets affected. We've got sleep hygiene management also over here. Now, if you have a person who's snoring, obstructive sleep apnea, that is also something which could be looked into. So specifically from sleep, mood, behavior, all these things need to be looked into for neck and back pain. Their behavior patterns of how they sit, walk. So short-term plan, intermediate and long-term plan is what we can categorize how we have a management.
And lifestyle change and exercise, these are important?
Absolutely, they're important.
Okay.
Once you've actually intervened from the physical aspect, if the small disc is there, which is pinching the nerve, you've done specific targeted injections. As I told you, we do it on the daycare basis. The pinched nerve irritation comes down. After that, whatever the surrounding muscles it's going to supply actually starts relaxing. At that point of time, your intermediate plan would be to actually have a physiotherapy, guided myofascial release, myofascial stretches and things like that, which the patient is trained and then they go back and do those exercises at home and get rehabilitated.
So the most important thing, for example, you talked about physiotherapy. There is a common thought that if I go to a physiotherapist, I have to strengthen myself. What does that do to chronic pain? Is it all about strengthening our muscles?
So here is, we'll have to look at a patient. Now, if a nerve is pinched, most of the muscles are already in spasm. At this point of time, first initially we tell them to stretch, loosen it, get the complete benefit out of it. After that has been done, probably could be a month later or so, when we revisit, that the patient comes for a revisit to us, then we examine the patient and tell, now's the time to tone. Or a patient is not sleeping well. He's too anxious, okay? Now, sleep and mood, anxiety as well as sleep deprived. Now, once you have sleep deprived, your muscles don't relax at all. So doing an isometric over there, strengthening is going to worsen his pain. Or a patient has got really anxious. He's being really in too much of stress. Could be from professional work or stresses at home. Could be multiple reasons at stresses at home. That also leads to a lot of muscle spasms. Now, in these group of patients, you go and do isometrics,
It's going to
worsening
worsen
the
it.
pain. So therefore, it has to be more or less. First is assessment, coming to the right kind of not only diagnosis, who the person has got this disease. That is how we actually go about in a pain clinic. So if you diagnose the personality trait, then it becomes easier to tailor make for that individual.
What are the other things that non-medically that a person can do to improve, apart, like you said, stretches, swimming and other things that you normally would talk about? How important is it to do these kind of activities?
So lifestyle changes play a very important role. Now, if you want to have a positive outlook to your life, you want to go back to your socialization. So then your swimming and others will actually make it much better, especially for your back and neck, wherein you don't have an impact on your spine. You're on the water, you're toning yourself. That is something which is zero impact in terms of destruction to your spine and strengthening your spine happening at the same time. So swimming, it could be. General walking, it could be in terms of doing exercises when you're sitting on your own chair at your own workstation. Itself goes a long way in improving your neck, back. Not only that, shoulder, hand, hip, all of this could actually be tremendously managed at their own work site.
So chronic pain clinic actually takes care of you completely. And at Aster CMI, we spend a lot of time to talk about individualizing, the right kind of investigations, the appropriate intervention, and a holistic approach with guidance of how to become better people as well as live life to the fullest with a work-life balance.
Absolutely. The patient-related outcomes is what is very important. So once we go from the individualized plan, I'm sure we will be able to get
Able to get
this.
Thank you.
Thank you.